This is a seated hypothenar mammillary push. This will be for segments T12 to L5. Indications would be restrictions in rotation or rotations and lateral flexion. And this could be coupled with restricted flexion or extension. Now, the table is in a neutral position, so the head piece is level, the thoracic and lumbar piece are level, and the foot piece is pushed in. Patient position, of course, is seated, but I want to be sure that the patient is straddling the table to help with stability for this adjustment. In addition to that, patient's going to have their arms crossed, and I'm going to have the arm over the top of the other arm that I am going to be grasping to help make this adjustment happen. So I am standing on the patient's left. My contact is going to be on the right side of the spine. So it is a contralateral contact for me. I can either be standing or seated, contralateral to the side that I need to make contact. Now, my hypothenar eminence of my posterior hand is my contact point. My segmental contact point, of course, is the appropriate mammillary process on the contralateral side. My stabilizing hand or indifferent hand is my anterior hand, and I'm going to be using that hand to grasp the opposite side arm or shoulder of the patient. Now, my tissue pull is going to be P to A, medial to lateral to get onto that mammillary process. My line of drive is also going to be P to A, medial to lateral. And my force generation for this is going to be a rotational force using my arms and torso. So I've got my anterior contact. I'll find my posterior contact on the mammillary process and take a tissue pull P to A, medial to lateral. I am going to slightly flex my patient forward. I am going to laterally flex away from the side of contact, and then I'm going to rotate the patient to get to pre-tension. And then, like I said, I'm using my arms and torso and the anterior contact to create a rotational force to make the adjustment happen. And that is the seated hypothenar mammillary push.